I've tried fad diets, powders, pills. Still, my weight's been up and down like a yo-yo until the AIDS plan taught me how to take off weight and help keep it off.
AIDS may taste like a candy, but AIDS contains one of the most effective appetite suppressants you can buy. And there's no stimulant in AIDS that could make you nervous.
With AIDS, I ate less, so the weight came off. To help keep it off when I sometimes want things loaded with calories, AIDS helps put me in control.
Let the AIDS plan teach you how to take off weight and help keep it off. Try peanut butter AIDS.
Good morning. Welcome back to the Morning Slice with Rob and Chris. I'm Rob.
And I'm Chris. Thank you again for tuning into our show, coming to you from our Krusty Hill community.
Well, that was a fun first segment we had, wasn't it?
Oh my gosh.
All those funny internet clips.
That's so funny.
I think my favorite one was that cat.
Yeah.
It was wearing a t-shirt and playing a keyboard.
Yeah.
How did they get that cat to do that?
I have no idea, but it's so hilarious even after all these years.
Jeez, what do you mean after all these years?
Well, it's like a few years old. You
Well,
knew that, right?
I did. I guess I saw it the first time and I liked it. I think it's funny.
I think it's hilarious.
And, you know, I think my kids will like it too because, you know, I'm a youth minister down at Krusty Hills Baptist.
Oh.
We're having a chili cook-off this Saturday.
Okay.
I'm going to show them that. It's going to be such a hoot. I can't wait.
Everyone's going to love it.
I'm sure they will. Well, you know, most times we have nice light subjects on here, but today we've got a bit of a downer, I think, talking about STDs.
Yes, we do.
Which two are we talking about?
HPV and gonorrhea.
Oh, those sound yucky. I don't want to get any of those.
Oh, me too.
I had crabs once, but that's not really an STD, is it? It's more like lice. Speaking of crabs, we got a couple guests today, and I kind of know the first one. You have history, but that's not important. Welcome, Dr. Rodgers.
Welcome, Dr. Rodgers. Nice to have you here with us today.
Hello, Joe.
Good morning, Chris. Thanks for having me on the show. I work in the gynecology floor at Krusty Hills Community Hospital, so I see HPV more often than I'd like. And I'm here to hopefully spread awareness and dispel some false assumptions against HPV.
False assumptions, such as?
For instance, many people think HPV is associated with the herpes simplex virus.
Oh, I'm so glad you're here to spread awareness. That sounds like an easy mix-up. Not everyone's a smart doctor like you are. So what exactly is HPV?
Well, Robert, HPV is a viral STD that most sexually active men and women have. It can spread orally, through the vagina, and through anal sex. Most of the strains are harmless and never present symptoms. Usually, HPV goes away by itself, and most carriers are not aware they have it. In the case that it does not go away, it can lead to genital warts and even cervical cancer in women. And in some cases, it can cause oropharyngeal cancer.
So you're saying anyone at this table right now could have HPV and not even know it. That's comforting. Is there any way for our viewers to get tested for this?
Unfortunately, there are no tests available to test specifically for HPV. Routine pap smears help identify cancerous cells in the cervix. Genital warts can appear too. Even though a person is not experiencing any symptoms, it's encouraged for two people to get tested for STDs before having intercourse. Limiting the number of partners helps reduce the chances of contracting this virus. Abstinence is 100% effective, and barriers such as male and female condoms can also help prevent the spread.
Yeah, abstinence, that's going to work.
Are there any other treatments available?
There are currently no treatments available for the virus itself, but there are vaccines available. The vaccination is a series of 3 shots administered over a period of 6 months. It is suggested for children ages 11 or 12. If the vaccination is missed during this period, there is a possibility for a vaccination for women up to age 26 and males up to age 21.
So how common is this? Since you might have it and you might not even know it.
In America, there are about 79 million Americans infected now, and approximately 14 million get infected with HPV each year. In the cases of genital warts, there are about 360,000 Americans, and about 10,000 women get cervical cancer. This number could be lower with regular screening. Cervical cancer can lead to infertility, the need for removal of the cervix, and in worst cases, a complete hysterectomy. If caught early, this could all be prevented by early treatment of the symptoms.
So almost everyone has it. There's no way to test for it, and most of the time, it's harmless. I guess the worst case is men get throat cancer and women get cervical cancer. So it kind of sounds like no big deal. We could just run around and do what we want.
No, Robert. The big deal of it is that cancer can be avoided. You know what, Robert? Is there something
Hey,
to try?
thank you so much, Dr. Rodgers, for coming in. It's very informative. Let's just all remember this is spread through sexual contact. And be aware of your partners and use protection and get tested regularly.
Thank you for coming in today, Dr. Rodgers, and thank you for all the work that you do.
Thank you too, Chris, for having me on this show so I can continue to spread awareness of this controllable disease.
You're welcome. And I believe you brought us a clip to show to our viewers.
Yes, ma'am.
Run the clip, Steve.
What is HPV? Human papilloma?
Human papilloma?
Human papillomavirus is HPV. Did you know HPV is the leading cause of cervical cancer in most women? 75% of women and men will contract HPV through sexual intercourse at one point in their lifetime. Infected? There are many ways you can lower your risk in prevention of cervical cancer. 1, you can build your immune system or reduce the amount of smoking. Protected? Are you under the age of 26? Take that step. Get vaccinated. Oh wait, you're a virgin? There's no excuse. Declare prevention now. HPV doesn't carry your name. It has no respective age or no preferred gender. Cervical cancer is the second most common cancer in women. Have you been tested? Married? Single? Divorced? Sex from time to time? Or abstinent? Go get a pap smear. Women, we need our regular pap smear. Our body is our temple. Take pride in a pap. We can be one less. You are one less. You're not alone or exempt. Cervical cancer is not the answer. Pap smears are needed. But most importantly, your life is worth it.
HPV infection is infection caused by the double-stranded DNA virus that is one of the oncogenic viruses. Goes into the cell and can cause several diseases. Human papillomavirus that belongs to the high-risk group causes cervical cancer. There is another group of human papillomavirus that we commonly call low risk. They very rarely cause cancer. There are also type of human papillomavirus that not involved in any of genital diseases, like flat warts. Many people are asking, if I have a wart on my skin, on my finger, that's how I got my HPV. It's not exactly true, because this is a different type of a virus. What are the implications of being infected with human papillomavirus? If you have a big lesion, it's going to prevent you from having your normal life, from exercising, from having intercourse, from going to the bathroom, from cleaning yourself. So those are worst case scenario. And the worst case scenario is having high-risk human papillomavirus not being examined, or being examined and not being compliant, and letting it to progress to something very, very difficult to treat. There is no specific treatment for human papillomavirus. There is no medication for it. There is no antibiotic for it. So what you do, you try to wake up immune system and you apply chemical substances, laser, you burn it, you cut it, you freeze it, it's gone. Is it gonna come back? Most likely. But this is the nature of the disease. The vast majority of the population who is sexually active, 85% of people, have human papillomavirus at some point of their lives. How can you prevent it from happening? Healthy lifestyle. Annually pap smears, checkups, repeat pap smears. Don't be afraid of that.
Welcome back to the show.
You know, I guess that was a pretty good topic after all.
You know, me too. Any kind of awareness is a good thing. And our next topic is very common here in the U.S., with new cases popping up every year. According to the CDC, there are as many as 700,000, with less than half of that reported.
Dang, that's a lot.
Yeah.
You know, our next guest is a hospitalist in the Krusty Hills Community Hospital, and she's going to tell us about an old favorite, gonorrhea. That just sounds ugly, doesn't it?
Oh my gosh.
You know, I heard this gonorrhea is starting to become resistant to the medications and antibiotics we're using on it. That's terrible.
Yes, it is true and very scary. I believe she's doing a study right now.
She's probably at the lab or somewhere right now. She couldn't join us on set, so she's doing a little video cam conference here. Steve, you want to get that ready? Let's just get on with it without any further ado. Dr. Saldago.
It's Dr. Karla Saldago.
Sorry.
Good morning, Dr. Saldago.
Oh,
Thank
well,
you for
good
joining
morning.
us today.
Thank you for having me here today, Chris. I hope to also spread the word about another STD, which if handled carefully, can also be controlled.
Me too. So, what can you tell us about its signs and symptoms?
Gonorrhea, also called the drip or the clap, infects both men and women. It can be spread through sexual contact. The microbe that are responsible for this infection is a gram-negative bacterium. It's fastidious that can grow rapidly in the mucous membranes in the body.
Such as the mouth, the throat, cervix, fallopian tube, uterus, and anus, right?
That is correct, Chris. And like I said before, this infection is very contagious and can be transmitted sexually.
Well, that sounds unpleasant. This used to be a curable infection with a simple antibiotic regimen, right? Can you tell us about why these little guys are becoming immune to our antibiotics?
First of all, it's the overprescription of antibiotics. If you take antibiotics needlessly, it basically leads to this bacteria, these superbugs that, continue to reproduce. The weak bacteria dies, the strongest bacteria lives on, they reproduce, they essentially evolve into these so-called superbugs, and it's really, really hard to treat people who have these illnesses.
One of them is antibiotic-resistant gonorrhea.
Yeah, we've done stories on that before.
That's like the second most urgent threats according to the CDC. Okay, my guess is you really, really don't want antibiotic-resistant gonorrhea.
Yeah, you should wear a condom if you're having sex with someone that you think is a little sketchy.
Yeah,
or just don't have sex with them.
You know how many infections there are every year of that killer kind of gonorrhea? 246,000 infections per year. Mm-hmm. Man, that's nothing to clap over.
You're terrible. You're terrible. That was a bad joke.
Okay, really?
Antibiotic use promotes development of antibiotic-resistant bacteria. Every time a person takes antibiotics, sensitive bacteria are killed, but resistant germs may be left to grow and multiply. Antibiotic resistance occurs when bacteria change in some way that reduces or eliminates the effectiveness of drugs, chemicals, or other agents designed to cure or prevent infections. Antibiotics kill or inhibit the bacteria that is being targeted, although sometimes one of the bacteria survives because it has the ability to neutralize or escape the effect of the antibiotic. That one bacterium can then multiply and replace all the bacteria that were killed.
And which type of antibiotics are they becoming resistant to?
Since it's already resistant to antibiotics such as quinolones, penicillin, tetracycline, and sulfa drugs, unfortunately there's only one treatment left: cephalosporins. If you are suffering from gonorrhea and don't get treated, this can lead to pelvic inflammatory disease, formation of scars in fallopian tubes, and infertility in both men and women. It can also lead to affect the joints and the blood.
Well, thank you so much for coming in today and giving us all of this information.
Thank you, Rob and Chris, for allowing me to talk to the audience today.
Don't forget, if you're not sure, get tested. I mean, if you're suffering from gonorrhea, take your course of antibiotics with the right dosage at the right time, and try to limit your sexual activity so that you don't infect anyone else.
Well, thank you for tuning in with us today, and be sure to join us tomorrow when we continue our coverage on STDs. Tomorrow's topic: is zombieism an STD? We'll leave you with a fun little video that Dr. Saldago found from her own Krusty Hill Community High School. Enjoy and have a great day.
Maybe this Addis method will work a little bit better. Yo, let's kick it. Gonorrhea is also known as Syria. Gonorrhea. Gonorrhea. All right, stop. Collaborate and listen. Gonorrhea is back and it's time to pay attention. Ages 15 to 24. Symptoms are harsh, but treatment's in store. Will it ever stop? No, we don't know. So go see a doctor or else it'll grow. It's an ancient disease caused by a guy named Nisi who confused infected pus with normal semen. Transmitted through sex or through water. Just harms that are latex. Symptoms aren't usually there. If you got gonorrhea, you are probably aware. Discharge, pus, painful urination are stuff that can happen like lower inflammation. If that's a problem, yo, we'll solve it. Get penicillin or antibiotics. Oh my God. Gonorrhea. We out.
The old French word for brothel, clapier, is thought to be the origin of the slang term for gonorrhea, the clap. It remains the most common sexually transmitted infection in the world. Up to 2/3 of new cases are in young people under the age of 25, many of whom will not know what they have. Gonorrhea has been known about as a bacterial infection for over 150 years. A dose of the clap might not sound that serious, but untreated, gonorrhea can cause both serious and permanent health problems in both men and women.
Gonorrhea is a bacteria that's spread from sexual contact, either oral sex or unprotected vaginal or anal sex. It can affect the throat, it can affect the rectum, and it can affect the cervix and urethra of women, and the urethras of men.
Gonorrhea is highly infectious. You stand up to a 1 in 4 chance of catching it from an infected partner through unprotected sex. More men are diagnosed with gonorrhea as their symptoms are easier to spot.
This slide shows the case of a young man who came to clinic complaining of a discharge. You can see there's a thick yellow discharge coming out of the tip of the penis. There's some slight redness around the head of the penis also. He had this yellow discharge which had been there for about 3 days, and it was intensely painful when he went for a pee. He described it as, "Doc, it's like peeing broken glass."
If gonorrhea isn't treated at this stage, the infection can spread up towards the bladder, down the channels which connect with the prostate gland, and into the testicles, where it causes severe inflammation.
It can cause epididymal orchitis, inflammation of the tubes around the testicles and the testicles themselves, and it can be a very painful condition.
If you're a man, you're quite likely to notice you've caught gonorrhea, but up to 80% of women may not experience any symptoms at all.
Gonorrhea is more of a problem for women because they can often have a slight discharge and no discharge at all, and they don't know they've got the infection. And of course then after a while the infection can travel up through the uterus into the fallopian tubes and cause a condition called pelvic inflammatory disease. And that is where the tubes fill with pus and buckle and get all contorted, and then it becomes a really painful acute condition. And if that's not diagnosed and treated properly, the tubes can be damaged permanently, and the woman can be left with tubal infertility and chronic pelvic pain.
The gonorrhea bacteria can attack the body in some quite surprising places.
This slide shows a young man who's got gonorrhea of the eye. How would somebody get gonorrhea in the eye? Well, obviously, if somebody has a discharge from the penis and they go for a pee and the discharge is on their finger and then they rub their eye, you can easily transmit it to yourself like that. Or there are other ways, just use your imagination.
Gonorrhea is currently on the rise amongst young people, and particularly in inner cities. So what can you do to protect yourself?
You can either say no, you can say yes, but always with a condom, and you can say, see, oops, we've made a mistake, let's go and get ourselves checked.